What is fringe money?
It's if you do contract work for the city, if you're not paying the benefits, you have to, first of all, the fringe wage, which is a different wage, it's a higher wage. It's like an $18 an hour worker will now make like $30 an hour.
Okay.
All right, and then if you don't offer benefits, they might tack on another $8 an hour to the employee. So the employee, and he wanted to get rid of paying the fringe, but the employees wouldn't take the plan. Remember?
That's right. I do remember. But to that point, so what had happened was we would go into, and we go into them today. And interestingly enough, it amazes me today that we've got food restaurants. I'm going to say not necessarily franchises, but restaurants that might have 300-400 employees. And the owners are thinking to themselves, well, you know what? We've got, different names on the ownership of each entity, but they all own each of these different restaurants. So when you're taking a look at it, it's a matter of common ownership. If you have 80% common ownership, they still have to, they're deemed as one employer. So they still have to provide benefits to deemed affordable. And they're not doing it. And I'll tell you what, we're going to get into it in a little bit. They could be subject to these penalties.
But then you also have this other problem too, is where they all say you have 50 FTE and you have to offer these benefits as a fast food.
Yeah.
Okay. Now, maybe the majority of them all turn it down. Some of them are covered, some of them aren't covered. When you pull out the ones that already have coverage, then you can waive them and approve. But if only 2 people take the plan and 30 people just decline it and they don't have coverage, you're still not going to qualify for the plan because you have too many people turning it down.
You are so right to that point. So true. But with that point, and a lot of the insurance companies really don't want anybody to know this, but there is a special federal open enrollment period from November 15th to December 15th for small group coverage in New York that insurance carriers cannot impose participation requirements on the employers, right? If they have their open enrollment period between November 15th and December 15th, so it could either be for a December 1st effective date or January 1st effective date, the insurance carriers cannot impose participation requirements. And that's huge.
That is huge.
There's a lot of these employers, with these lower wage employees, to your point, they are in no way going to meet participation.
They do that to force, say, the fast food owner to be compliant. For example, a fast food owner, 11 months of the year, can say, hey, I can't have the plan because nobody's joining, and I'm not, so how can you tell me to be compliant?
Yeah.
Is that what they do? They put that little one thing there?
Well, what the employers do is that, those restaurants, we make sure the open enrollments are we set them up during that time frame.
Right.
And the open enrollments have to be during that time frame also.
Right.
Because once you step out of
That's
that
what
for
I
a
mean.
minute, they're going to bang you out.
That's why they do that, right, yeah. Mhm.
Yeah, and they don't want to do it because what's going to happen? Who's going to sign on to the plan? They got 77 employees, all right? 76 of them aren't going to take it. Who's that one guy that's going to sign on to the plan? The sick guy. Right. So that's the definition of adverse selection.
Mhm.
Now, interestingly enough, to that point, what you want to take a look at is, it's always important, or at least our job, is to try to minimize the cost to the employers. Minimize the cost to the employers. Cost to the employers first, employees second. I hate to phrase it like that, but that's really the reality of life, right? So what did we talk about before in order to mitigate costs? Children's Health Plus. If you're able, if kids, see if Children's Health Plus is a viable option, right? That's number one. Number two, and you're not going to hear this much, but interestingly enough, with respect to the Affordable Care Act, the contribution requirement is only made on that 60% actual bronze plan. Now, if I'm married, I can, if I'm a large group that's experience rated, when my rates are going to be based upon the claims. A large group, now, over 100 employees, 500, 600, whatever, and you see it with larger companies, you don't see it. I could say, the employer could say, hey, listen, this is all part of the Affordable Care Act, that if I'm married and my wife or my spouse is working and she's got access to care through her employer, she can't come onto my plan. So I could mandate that she has to go under her plan, number one. So that'll help mitigate risk, right? And then the other thing that we try to do to help mitigate risk, and this gets a little bit, you have to be careful with this, is Medicare. Let's look at Medicare, health insurance for old people, right?
You know, the misconception, people think it's free, and it is not.
That's right.
It's not cheap either, and you need supplements, drug plans, dental plans.
So you're no longer on your private health insurance anymore, you just.
No, you
Let's
have
talk
both.
about this.
You could have,
You can have both.
but you don't have to
No,
take
no.
Medicare. You can enroll but not pay premiums, and just take it when you need it.
But then then your regular health insurance question is always, do you have any alternative coverage? And they always, your primary wants to take a back seat to Medicare
Right.
all the time. So how do you not? I mean, it's-
Well, you just enroll.
But let's talk about that for
Yeah,
2
you
seconds.
just enroll.
So what'll happen here is this. Let's talk about employer group size for a moment. Employer group size.
Mhm.
Okay, fair enough? So if an employer has between 2 to 19 employees, less than 20, the group has less than 20, then by default, Medicare is going to be primary over any group plan. Medicare is going to be primary over any group plan. If you have 20 or more, then the private health and the group health plan is going to be primary over Medicare. So now let's talk about what Sherry brought up, and she's absolutely right. So now what happens when somebody's 65? Medicare has several parts. There's Part A, which is hospital. Part A hospital is free because you've been paying into Social Security, right? Then, and here's where the analysis comes in. Here's where it comes in. Then you have to take a look. Part B is doctors. And there's a premium. And the premium for that, and I have it in your kit there, it's means based. So they're going to look at your tax return from 2 years ago to determine what the premium is going to be. The base premium is about $185 per month for Part B. And then as your income goes up, it goes to roughly $630 a month.
It's still cheaper.
Which is
Well, that's
ridiculous
cheap.
because they look back, and if you retire, you're not getting that income.
Well, again, good point, because what you could always do is you could file to have that premium
Amended.
reduced. Exactly right.